A very good morning to you all. Welcome along to Sunrise Daily today. I'm Chamberlain. So
beautiful Wednesday morning from here in Lagos, Nigeria. You're welcome. I'm Kayode Okikulu.
And it's not raining today here in the Federal Capital Territory. Good morning, I'm Maokwe Ogunyesef.
Well, great things happening that we can actually point to. But one thing for a lot of people is the delivery of the COVID-19 vaccines and the eventual kickstarting of vaccination. And I know there's been a mixed bag, really, with this COVID-19. And it's important to have these conversations, not just, focus on the seemingly good ones and forget the bad ones, or at least the controversial ones. I think that's a better way to put it. So the MPHCDA has been speaking about vaccination, right? Because it's the agency primarily responsible for vaccination in Nigeria. And the boss of the agency says, well, when we have enough vaccines, right? So let me just paraphrase so you'll understand the conversation this morning. When we have enough vaccines, then we need to have that conversation around vaccination. And I believe you know what that means. So for now, we don't have enough, right? So just a few Nigerians have been vaccinated. Even less have gotten their full dose, right? Some have been gotten their first dose. But the point is this. That tough conversation seemed to have happened in Edo State already. And you recall that last week the state government spoke about, making vaccination compulsory of sorts. And that followed, or right after that, we had civil societies coming out to say, well, slow down. Don't you think that's an infringement on our rights? I mean, this was a matter of when, really, not a matter of if. It was always going to happen. I mean, this particular conversation. We've seen what played out in other countries, how presidents were literally begging people to take the vaccine because of the harm it has caused. I mean, COVID-19 has caused to the health sector, to the economy, which is always the huge one, really. So it was only a matter of when to have that conversation in Nigeria. So while we're having this conversation, may I just also put the conversation about cholera in the mix as well? I hate to do this, but it's a reality of things. COVID-19, we've lost over 2,000 people to COVID-19 from January or February last year up till this moment. But when you take a look at the figures for cholera as well, over 800 deaths in just 7 months this year. So I would like for us to have that tough conversation as well about cholera, because both of them in their own light are pandemics.
Okay.
Can anyone fault that? I mean, that statement in terms of whether or not cholera is now a pandemic? As we saw it move from state to state, and it was seemed that it was just a matter of time before any other state declared that they had now seen an outbreak of cholera. I think the latest we saw was from Borno. And as I did say before, that if Borno was declaring cases of cholera, we could understand, because we've seen the humanitarian situation that currently prevails in Borno State as a result of years of fighting terrorism in that particular state. But some states, I mean, we have not. I'm not excusing what is happening in Borno. I'm just saying that some things might be expected in a state like Borno. I'm not saying that. That's not to say that we couldn't have done more to prevent it. So, for instance, there are questions that we ask as to where is this happening? Is it happening in the camps? Is it happening in the settlements where you have a lot of people who have moved from, areas where you cannot even leave to Maiduguri, the main city in Borno, So there could have been questions as to whether or not we could have preempted this. But nonetheless, one would say, there is a humanitarian crisis in Borno, and so that could happen there. However, in the states where there is no humanitarian crisis, where we have relative peace, where people go about their duties on a normal basis, what is the excuse for those states? That's a big question for me. I'm still asking. We're yet to get answers. And I think what is even more troublesome is the fact that we haven't really seen a concerted response on the part of state governments to do something about this. It's one thing, yes, for you to set up camps and say, they're sick now, we can look after them. excuse me, the second question will be, what did we do to prevent them? And now that we're seeing people falling ill as a result of it, what are we doing to address what we know is the root cause of having cholera in our states? And I think that the easy answer is, what are we doing about water, portable water for citizens? That's the question. When you look at the number of people, so far so good, I think a huge number of people, close to over 58,000 people, we understand, have been infected as a result of cholera. And I think since the last outbreak, it's actually more than 800 people who have lost their lives. God, for the life of me, I can't get my finger on the figure right now, and I'm very reluctant to declare one. But I do know that if you declare that for the last 7 months, the figure has since gone up from the number which you just declared. 800 is disturbing enough in 7 months to cholera, especially when you think of the fact that this is a totally preventable disease. Now we're moving on to something else, which we say, okay, it's a novel disease, and it has taken the world by storm. It's something that the world never really did see coming, and there have been attempts right now to try and find solutions to this, and that's the reason why we have vaccination. That's the reason why we have developed vaccines. However, on an emergency basis, these vaccines have come and are now in use. We've seen situations whereby they have been able to stem the spread of COVID-19 in many countries, and thankfully Nigeria is getting vaccines, both the ones that have been donated to it and the ones that it's also procuring by itself. I think Nigeria has been procuring the single dose the Pfizer vaccines. I hope I'm correct. Yeah, Pfizer vaccines are the ones that are the single dose vaccines. Am I correct on that? Just clarifying. I know the AstraZeneca is double doses and the Moderna is double doses as well. I'm trying to remember. Johnson & Johnson. It's the Johnson & Johnson vaccine that is the single-dose vaccine. So I know Nigeria is getting a lot of that to try and augment the ones that it's also getting being donated to it. Now, if that is the situation, what has the drive been? That's the question. So it would seem that perhaps we're not getting a lot of uptake of the vaccines that have been donated already, even though we understand that the AstraZeneca vaccine went round effectively and that it would seem that there was some enthusiasm. Perhaps, I don't know, we're not able to measure what the enthusiasm has been since we received the Moderna vaccine and since we received the first batch of the Johnson & Johnson vaccine, which we were told was going to go to rural areas. For the countries where people are being begged to take vaccines, if you see how the place has been set up, for instance, if you go to malls, there is easy accessibility to the vaccines. We know that we do not like to go to hospitals unless we really have to. So if the vaccines are in hospitals and you're thinking that, people are just going to drive there, to go and get vaccinated when they really do not have a cause to. For instance, where you're traveling out of the country, where it is now made compulsory for you to, and you have to go and look for a vaccination center, then I think that we really we don't understand what we're up against in terms of vaccine hesitancy or even trying to encourage people to take these vaccines. Yes, I know that we're waiting till we get enough so that in case we see more interest, I don't know if that's what we're waiting for, but I would imagine that even if we're beginning to test, if we want to test the waters and see how receptive people are to these vaccines, one of the first things we will do is take it to the people. When we wanted to do polio vaccination, what did we do? When we wanted to get rid of polio, we took it everywhere there were children. We took it to schools, we took it to churches, mosques, we took it to recreation centers, and we made parents give their children this vaccine. So we're not seeing that sort of drive just yet. So I think it would be premature to say that Nigerians are hesitant to take the vaccines. Right now, as we speak, they're only in healthcare centers. Yes, there have been drives to ensure that in some institutions, they're able to collaborate with some public institutions or some companies, some corporate companies, to see how their members of staff can have access to these vaccines. But until we take it to the people, it's very difficult, as I did say, and premature to determine whether or not the people are hesitant about taking vaccination, especially the COVID-19 vaccines. Gentlemen.
Well, yeah, I mean, you guys have pointed out quite a number of things, but it's going to be very, the WHO site, first of all, indicates that you have just a little over 4 million jabs, 4 million people that have taken that vaccine in the country. And when they say when we'll have enough. It's kind of open-ended. What's the target? What are we looking to?
Going by the projection, that would be like at least 5 years or more.
Well,
I mean, going by how fast we're moving right now.
Oh dear. But look, it's good for people to be safe than sorry. When you can. So those who have taken it have checked out and they feel well, they've listened to medical experts and suggestions. And those who also say a thing or two, because I mean, this, much as yes, it provides you that layer of protection, but the message in there comes across the store when you have that jab, it's all, clear. Yes, it will give you that layer of protection, but we've also heard those medical experts say that it doesn't necessarily mean that you can, get infected or transmitted. You still can.
Yeah, well, it reduces that risk.
Yeah, so when Dr. Faisal says, those who have vaccinated have a right not to be infected. So I don't understand that context because both parties, whether you've been vaccinated or not, you can be infected, you can still spread it. That's why they encourage everyone, whether you've been vaccinated or not, put on your mask. It's safe for you, so that you don't endanger other people's lives while you can. It's going to be very tricky how they handle all of these things because we don't want a scenario to develop where you have lots of people misinformed and going about certain things in certain ways. But it's always better to be safe than sorry. So maybe when we'll have a lot more details about what they mean, the target, when are we going to have enough, what's the composition, what's the thinking, how do they plan to have that composition, what will be the content of this conversation, I guess we'll see. But there you go. All right, we'll go ahead now and take a look at what the dailies are highlighting today. So where do we start from? Well, I've got Daily Trust here for a start, so might as well just go there. Anti-open grazing, Imo opts out as Lagos, Ogun, Edo, Anambra delay law. Herders ask for more time in Enugu. Rivers, Ondo, Bayelsa, Ekiti, others vow to implement law. No southern state should fail to pass law. Afenifere Ohaneze Ndibo Pandem. That's what you see right there. So it's going to be also Ondo signing that yesterday. So
would you say just in the nick of time? Well, saying the resolution of the southern governors, and they gave a deadline. So.
Well. I guess we'll just always keep tabs and see how it does unfold. But right about that, JAMB scraps general cutoff marks for admissions. So what does that mean now? Have they scrapped what ELDS, educationally less developed states, and then because I guess yes, you have to read the story to put it in proper context. If they're scrapping general cutoff marks, does that mean that okay? Well, everybody, you made the target, you made the target. If you don't make the target, you what?
So I think it's quite interesting. On the one hand, I imagine a lot of people thinking, why didn't you do this in my time when I was trying to meet the cutoff mark? But the point is democratizing this, so allow schools. Yeah, allow schools to decide.
300. The other can be 350, and you can be
120.
Whoa!
So allow schools essentially say, okay, based on what we've seen in our area and all, this is our cutoff mark. You're welcome to enroll if you want to. So I know the conversation the debate will continue, but for me, I think it's a good one.
Okay, so there you go. Just go ahead and see the story, but right beneath that lead story. Insecurity forces Katsina, Kaduna, Niger, Zamfara to lock down. I know many don't want to hear that word, lockdown, but this is what it is right here. And the writer here says, states working together to strangle bandits. Bandits, terrorists, whichever way.
I like the sound of that, really.
You do?
Because if anything, they have strangled states in the nation, so...
Now it's time to hit back.
Absolutely.
Perhaps strongly. And you kind of see that uniformity in terms of some of the policies, the markets, the regulation time, because I think they've seen they could be acting on security reports.
A trend, maybe.
Yeah, because when they go to the markets, some areas that usually were pauperized, I mean, you didn't have such funds. When I see funds flowing in those cities, and you say, whoa, which investor came in here? But it's funds from you know what. That's daily trust.
Well, for The Guardian, the lead is on COVID-19. Yeah, we had that discussion earlier. FG set to sanction Nigerians refusing COVID-19 vaccination. So that's an angle, right? But take a look at the riders. I mean, when you hear rights, I have a right, you have your right, and when my right is infringed upon, there should only
So how do you sanction people if they've got rights?
Like I think that will be part of the frank conversation which we have. But don't forget that condition, when we have enough, right? So... but it's always good to prepare. But see the riders, court restrains Obaseki from making vaccination compulsory.
Oh dear.
Edo civil servants get 7-day ultimatum to get inoculated. New C12 COVID-19 variant not spreading, says WHO. I recall that I think South Africa discovered yet another variant. But more stories on the front page. Akeredolu ignores Miyetti Allah, signs anti-open grazing bill into law. To the host of riders. Oyo anti-open grazing law not effective 2 years later. Enugu residents seek enactment of anti-open grazing law. Katsina bans interstate transport of cattle. Niger suspend cattle markets over insecurity. Afenifere raises concerns over alleged deployment of northern youth. So that's how the Guardian, I should say, captures some of those stories making the rounds this day. Of course, that JAM story is also there. And Allow Me honors DIA invitation over interview with Channels TV. That's a Guardian for you.
Well, so that news is certainly verified, but I think that the Vanguard helps me with the figure I was looking for this morning. Take a look at what's on the front page of the Vanguard. Nigeria hard hit as 2,035 die. That's the figure I was looking for, because I did know that I saw that figure yesterday, but I was reluctant to quote it because I wasn't certain of the exact number. But just in case you're wondering how many people we've lost to cholera and why we should take this a little more seriously, why there should be less politicking and a lot more conversation amongst the states and what is happening there. Look at it. Vanguard. Nigeria hard hit as 2,035 the people die of cholera in 23 states. And guess where else? The FCT. So that's all on the front page. 58,698 cases reported since January. Jigawa records 600 deaths. 16,217 cases in Bauchi. Katsina, Zamfara accounts for 73.9% of cases in 1 week. Nigeria created environment for cholera to thrive. That's according to the NEMA. Minister of Environment, NCDC DG, blame poor sanitation, lack of hygiene practices. So these are the riders to this lead story on the front page of the Vanguard, something that we should take quite seriously. US ready to help identify sponsors of Boko Haram. It's another story on the front page of the Vanguard for you. You have a number of other stories there. Buhari launches post-NYSC job scheme to absorb 20,000 graduates annually. PDP to DSS, pro-Bakume over Benue killings. It's a page that's in read. You also have that on the front page alongside your Mr. and Mrs. And of course, back page, World Cup qualifier, 25 players hit Eagles camp, 4 more expected. So for you football and sports lovers, let's leave it there for the Vanguard newspapers.
Well, take a look at New Telegraph next. Many are going to love this lead story. It's about terrorism. And then look at that. US ready to assist FG identify Boko Haram sponsors. Subscribe to Envoy. So, says both government officials have met thrice in 2 months. Purchase of 2 Kanu fighter jets, good omen, Europe Air Force Chief. So you'll be expecting, some action, cooperation about terrorism, financing, and so you never know. Just keep tabs on that one. Just right beneath that one as well, you see JAM cancels UTME cutoff marks. Well, how did some say? Okay, well, cancel scraps. Varsities to set individual benchmarks. Just note that. Prisoners, visually impaired, others now exempted from post-UTME. So, there you go. So, definitely some interesting times, isn't it? So,
yes.
Who knows? So, I remember that time that they were talking about making it, if you don't have your name, you can't go write JAM, and that hoopla was there, and many thought, well, if that's going to be the case, you have to use this name for voting. If everybody's got the name, what stops us from using it for voting? I think that will make a huge impact if that were to be the case. After all, who's afraid of the name?
I saw a video yesterday or a few days ago. It was one of the lawmakers speaking about how some people allegedly come into the country from bordering nations and then they register for NEMA and the rest. So that's also another challenge that needs to be looked into. But take a look at Daily Independent. We need to rush through this now. September 4, APC-LGA Congresses. Buhari backs Buni as forces ask him to quit as chairman. Stakeholders want Tinubu to speak out. That's politics. That's how Daily Independent leads. And you see, telcos lose revenue to slow deployment of 3G, 4G. Subscribers denied premium content. There's no 5G in this one. But hey, even the 3G and 4G, you see slow deployment. But when you look at their figures as well, they say they have 80% coverage, 90% coverage. But you know what? Let's leave it there for Daily Independent newspaper.
Look at what they have on your front page. No going back on open grazing ban. Southern governors declare. Governor Keredolu signs bill into law to beat deadline. Akwa Ibom, Enugu, Imo, Osun, Oyo yet to pass bill. Delta, Rivers, Ogun to deal with violators. No more headsmen in Ebonyi, says Commissioner. Katsina bans interstate movement of herders. Niger closes cattle market. So I have to be certain if that is Niger or Niger. But you will want to read the story on page 4 of the leadership newspapers. Today was supposed to be the deadline given by the southern governors for the ban on open grazing, and I think a lot of the papers are focusing on that this morning. Take a look at this. Federal government begs ASU to shelve strike. That's also there. PMB to Uba go and win Anambra poll for APC. It's a page 10 read. And in case you're looking for something somewhat controversial, take a look at this one. Borno probes shooting practice in hotel by NGO. It's a page 11 read. CBN directs banks to publish names of forex defaulters. That's also on the front page of leadership newspapers. Let's leave it there for the paper.
Look at Daily Times next. They've got that story about COVID and vaccines. There you go. Will apply basic law on Nigerians rejecting COVID-19 vaccine. FG says COVID-19 vaccination now mandatory for all pilgrims to Saudi Arabia and Israel. That's Daily Times.
Finally, Nigerian News Direct with this one. In case you missed it, 33% unemployment rate. Buhari UNDP launch job fellowship for 20,000 graduates. Page 11. Here, this is meant to be annually. But clearly, the details are meant to unfold in the coming days. And just finally, IPIS, FG to implement new ideas and strategies to sustain flawless payroll. So all the talk about UTAS, recall UTAS, there was another one. So it appears IPIS is the thing now. That's Nigerian News Direct.
And that's it with a look at some of the dailies as well today. We will be back in a moment. Don't go away.
Well, all has not been well in the medical sector for a while, despite all of the medical challenges that we're facing. We highlighted a few of them in the beginning part of this program. Talk about the outbreak of cholera in a number of states, in about 24 states. And you also talk about COVID-19, which we're yet to be really out of. However, despite all of that, our doctors, National Association of Resident Doctors, have been on strike for a while as a result of the refusal of the federal government to honor an agreement which is signed with them sometime in the past. Now, as a result of this, the umbrella body of doctors in the country, the Nigerian Medical Association, has decided to wade in. And in recent times, what we heard is that they had given the federal government a 21-day ultimatum to resolve the issues involving the affiliate members. Otherwise, well, some say the report was that they were going to go on strike, but it would seem that perhaps that was not the correct position. To shed a little more light on what exactly the NEMA is saying, why it will seem it has handed down this 21-day ultimatum, what will happen at the end of this 21-day ultimatum, and whether or not we can afford for our doctors to, go on strike if that is going to be the action. We have with us this morning Dr. Ekwe Phillips, who is the Secretary General of the Nigerian Medical Association. Doctor, you're welcome to Sunrise Elite this morning.
Thank you very much.
Well, quite a lot going on in the health sector, troubling quite a few Nigerians because we thought, okay, when the doctors gave their warning strike, we thought, okay, in a few days this matters should be resolved. But as we speak, it's yet to see any concrete resolution. Rather, we've seen the federal government threaten to go to court. We've heard the president say, all matters concerning the doctors should be resolved out of court. However, there's very little progress reported in that regard. I don't know if you're part of the negotiation process. What is happening there?
Well, thank you very much. As you know, NAD, that is Nigerian Association of Resident Doctors, about 16,000 in the country. They are the engine room of the medical profession. That the first, second, third, and fourth level. What I mean is a house officer is part of resident doctors. A senior house officer is part of resident doctors. A registrar 2 is part of resident doctor. A registrar 1, 2 is a part of resident doctor. And these are the processes before you become a consultant. So that the engine room, if they are not working, the health system, especially in the public hospital, will be collapsed. Now, they've had some agreement with federal government. They signed what they call memorandum of understanding, which the federal government reneged, despite all the discussions. And then subsequently, they signed another agreement called memorandum of action. And this memorandum of action means that the actionable things, they discuss ways they're going to go about it. And of course, resident doctors called out their strike for the sake of Nigerians. Again, federal government reneged. Well, I don't want to go into who reneged or who didn't in terms of, is it the leadership? Is it the bottleneck? But, this is what is expected. They should do what they're supposed to do. So, because of this, first of all, NAD no longer trusts government to be able to do what they're supposed to do. And one thing that has been agreed between federal government and National Association of Resident Doctors is that their demand is legitimate. They deserve what they are demanding. And all these are geared into delivering a quality and affordable health care to our system. Now, they went on this strike on the 2nd of August. Government did not call them to negotiation table. Rather, what they did is to take them to National Industrial Court. On what basis? You are the person that it is now on your own court. Now that call of their strike, you are the government, you are supposed to fulfill those things within the timelines that you discussed. And you didn't do that. And then you took them to National Industrial Court. It's akin to you are owing me. I'm asking you to pay me my debt. And then you take me to court. I'm not the one now taking you to court for not paying me. They are the one that took me to court for owing me. I don't understand. Do you understand what I'm saying? So it's really funny, and health should be considered as a very critical part of any nation. It should be a priority, and it's not something you play with. It's not something you begin to go to National Industrial Court and do negotiations. Let me tell you something. The ratio of doctors to patients in Nigeria is about 1 to about 6,000. And if you calculate it very well, it means that every doctor is doing the work of 60 doctors. They are tired. And that's why you see the brain drain occurring, you know. So it's something that, and for every time, think about it, Nigerians are dying by the minute because the public hospitals are the hospitals that the poor man can access, the masses can access. The security man at your gate has a wife, and the wife is pregnant. He cannot afford a private clinic. It has to go to government hospital, and it's not functional right now because NAD is not working. Let's not deceive ourselves. The consultant alone can't do the job. It's not possible. It's just absolutely not possible.
Well, even the consultants were not happy at some point. The Medical and Dental Consultants Association of Nigeria, Nnamdi Kanu, also...
Yes, they gave ultimatum. It's just that their own is recent. So probably that is why when government discussed with them, say, okay, well, let's call it off and see what's going to happen. I'm afraid government may renege if cash not taken. So we are watching. Yeah.
So, I mean, but this 21-day ultimatum which the NMA has now issued government, what is it about?
Well, let me put it well. You know, the wording we used was to place federal government on notice. We didn't use the word ultimatum, but you explained it to be ultimatum. It's okay. But we are giving them 21 days before we react. 21 days before we take a decision.
To do what precisely?
Well, we are not interested much about what to do. We're interested in solving the problem. In short, it's like giving government 21 days latitude. These are problems they can solve within 1 week. You remember that on the 2nd of August, NAD went on strike. They had all that time to do something. What did they do? They went to National Industrial Court until NMA came in, and then we now started discussing and said we signed a memorandum of understanding. We are hoping that within that 21 days, the memorandum of understanding we signed would have been fulfilled so that NAD will call out their strike. We are not interested in the strike. We are more interested in fulfilling the demands of NAD. Because I'm telling you now that every minute a Nigerian is dying because of this strike. So it's like saying, let's assume that about 50 persons are dying every day. And you say 21 days. That is how many? 50 times 20, that's about 1,000. So you're saying we're giving Nigerians 21 days for 1,000 Nigerians to die. I mean, it's not acceptable. That's why we're not even thinking about it. What we are working now is to see how the demands of NAD are met so that they can call out the strike as soon as possible for the healthcare system to get back. You know, people are dying.
So this 21 days is somewhat declared in solidarity with NAD.
Yeah, definitely. Well, before now, NMA has always supported NAD because NAD is an affiliate of NMA. It's part of us. We are aware. There's no time we say we're not aware of what is going on, you know. But this is to let you know that, look, a bigger stake, we're weighing in now. I mean, NMA is involved all the doctors in Nigeria and in diaspora. And so by the time NMA is making a statement, it should be taken very seriously. That is the point we are saying. And of course, there's going to be an emergency delegate meeting at the end of 21 days if government have not acted. But I think they're acting. I believe they're acting. Because I've not been sleeping in the past 3-4 days, going around to making sure that these things are being fulfilled, that they're working on it. You understand? But at the end of that 21 days, if nothing has been done, we are going to call what they call emergency delegate meeting. And in that meeting, we are going to deliberate, look at what have been done and what have not been done. If it's not worth it, that meeting will take a decision.
What do you mean if it's not worth it? What does that mean?
I mean, you know, for instance, I mean, you are owing me, let's say you're owing me 10,000 naira and then you pay me 100 naira. I mean, you know, or let's assume they've not done anything. Do you understand what I say? But I'm telling you that NMA is more interested in government doing something. We are optimistic and we believe that in a very short while, we should be able to achieve results. We've been going around and saying the leaders of the health industry. I mean, 2 days back, we saw the Minister of Health. We saw the Minister of State for Health. We saw the Permanent Secretary for Health. And we saw the Minister of Labor and Employment. And of course, they are also worried too. And they also want the resident doctors to get back to work. And are working towards fulfilling those issues. Well, if I may tell you, part of the reasons why these things are not fulfilled are the bottlenecks. They are not putting the weavers as adequate as it's supposed to be. Health is an emergency. It is not a situation where you start pushing files. It's a situation where you make a phone call that the file is coming. Please get this thing done. Because somebody's life is at stake. That's what we're talking about. You know, the bottlenecks and all the barriers have to be removed for things to move.
So on government's part, I mean, we've been having these conversations over and over again, particularly in the light of the brain drain we witnessed. I mean, just sometime last week, right here in Abuja, we saw a 3-day recruitment happening in a prominent hotel right here in the Federal Capital Territory. And the idea was to take away our doctors. And this exercise happens, at least I'm aware of it, on a yearly basis. Even when we were in the middle of a pandemic where, you know, the country was on lockdown and nobody was going anywhere, the people who were still sought after were our medical personnel, and foreign governments, you know, found ways to get to lure our doctors out of the country. So we understand the pressure in the sector. What I do not know is whether you're able to tell us from the conversations, from your interventions in the negotiations and what have you, what exactly does government say is the cog in the wheel of progress? Why is it so slow to addressing the issues? I mean, as you rightly pointed out, NAD went on strike on the 2nd of August. This is 1st of September 2021, and we're yet to see significant progress with them down in tools, or even with them fulfilling that's government fulfilling its own terms of the agreement signed with them. From what you've seen so far, what exactly is holding government back?
Well, when you discuss with government, the first thing they will tell you that there is no money, that the country economy is poor, and that are living on loans. They keep borrowing money, that even in the supplementary budget, they are going to go and borrow money to fund the supplementary budget. Well, it is our country. We have to keep it going. People are working, they must be paid salary. So whether you are taking loan or you're not taking loan, it's not an issue. It is your mandate to create a good economy, such a way that you reduce the loan you take, at the same time, pay those who are working. The second thing we discovered was that there are a lot of obstacles within the system. You are going to a particular office and you're pushing a file, and by the time it gets to the office of the head of service, it takes some delays, and they want to do all due diligence and all the processes, which will take probably some 3, 4, 5 weeks or more. Then it moves to budget, it's delayed again. It moves to Accountant General office, it's delayed again, and probably it gets to IP's delayed again. Also, all of a sudden, somebody can tell you, oh, hey, wait a minute, this person is not adequately qualified. These are the issues. So at the end of the day, you find out that it appears as if they're not serious. And then when NAD calls out their strike, they slow down. Everybody go to sleep. And that is why you see that now NAD is saying, NMA, despite talking to us, we don't want to hear. You understand what I say? If not, they will listen to NMA. But NMA too, I've not even found the good reason. Government have not given NMA the good reason to tell NAD, please, can you call off the strike? They have not, because they've reneged. Look at all the lists. They've reneged in all these things. None of them we can say is well completed. Many of them are hanging, while some have not been attended to, while some are putting almost obstacles that appear to be impossible. However, looking at the brain drain, it shows the where we are. Naturally, human flight is normal. Migration and migration is normal, but with regard to healthcare workers, not just doctors. It's just that because that doctors are leaders of the health team, their own seem to be bogus. Nurses are also living in droves. Laboratory scientists are living. Pharmacists are living. And now doctors are living. These countries are smart. UK, US, Australia, Saudi Arabia. Because every country still needs doctor. They all need doctors, including US, including UK. The recommendation by WHO is 600 patients to one doctor. And now Nigeria have trained these doctors to be very good. Nigerian doctors are really indeed very, very good. They're sorted after. And that's why you see that Saudi Arabia, they've done their investigation, they've done their background check. And they realize, look, we need to take them if their country cannot offer them anything. And that is why you see they're enticing the doctors with powerful remuneration. They are living where you are working to a place where they're going to pay you about 20 times your salary, and they're giving you free accommodation. They pay your ticket to come in there, and they make you have a vacation and pay for your family. What else do you want? And they have all the equipment and the facilities. Don't get me wrong. Nigerian doctors are very patriotic. And that is why NAD is going on this strike. It's part of patriotism, to draw government attention, to say, hey, wait, you're not doing the right thing they're supposed to do. You understand what I'm trying to say? They are smart. Nigeria should be smart to change the system, to say what is going on. Have a roundtable and let's say we need to stop this brain drain. You know, think about it. Even the facilities we work, very poor facilities. It's not a place you're proud of. It's not a place you can tell your friend come and visit you. The workload is so much. I've just told you that one doctor is doing the work of 60 doctors in this country. And again, let me also tell you, there are a lot of doctors roaming the street of Nigeria without job. Meanwhile, we need them. Our primary health care is not, over 50% is not manned by doctors. The basic amenity is not there. Then, what you and I know, insecurity is a huge reason, a very big reason why there is brain drain. The problems are much. We need to sit down in this country and do nation building. We are just sitting down on auto cruise, nothing is going on. We don't even know where we're heading to. And so a doctor is quite intelligent to begin to project what happens to this country in the next 5 years, in the next 10 years. It seems we're having a nosedive. Because when last did you hear from the news a good news from this country? Look at the cost of dollar. Dollar is costing over 500 naira, and we need to buy medical equipment. We don't manufacture them here.
So what I'm actually very concerned about is whether or not, these are the facts. In terms of the fact that we have doctors who are not employed, despite the fact that we don't have enough.
Very true. Let me tell you something. They brought what you call central posting for house officers.
Yes.
A medical graduate to graduate and wait sometimes up to 1 year before he gets his space.
So what I want to know...
A doctor who has finished housemanship and finished NYSC writes for an exam called primaries because he wants to progress in his career. And he waits 1, 2, 3 years looking for space to start residency training. And since there is no space, what do you expect him to do? When UK is offering a place, PLAB is so easy to pass. So
it's not that there is no space. What we understand is that the spaces in the federal institutions are saturated.
They're not saturated, ma.
Oh, okay.
Let me explain to you.
I'll let you explain that point. Yes. But what I want you to take up for us is what is happening at the state level, because we understand that a lot of the letting the ball down, the weak link are the states.
Yes, I will explain that. As you know, the states are independent. They fund their economy. They take care of the hospitals there. First, the states are also not employing. They're leaving the work, majority of the work for the federal government. You find out that they have federal government institutions in the states. And the doctors in those federal government institutions is much more than what the states are employing. It's bad enough. The states are not paying. I will tell you, for instance, Abia State is owing some of them 19 months, some of them 16 months, some of them 10 months. How can one live like that? It's not like these doctors have something else they're doing. You can imagine that you are a doctor, it's time for your children to go back to school, you cannot even afford it, they are borrowing money even to feed. Is it not enough to leave the country? Another state is Imo State, under the same line. Another state is Anambra State. Then you have Ondo State. Then you have Ekiti State, where you have the chairman of the Governors Forum. We have visited him, we discussed with him, and he said he was going to take it up. But we are still at the same point. So, NAD have to come and rescue his members. The job of NAD is majorly welfare of his members. And these doctors in these states are members of NAD.
So how are we taking up this conversation with the state?
Well, we have discussed with the Minister of Labour and Employment. He has mentioned that health is not even in the concurrent list, rather it is in the residual list. And therefore, they don't have so much influence. They can't do much about it rather than to talk to the governors, maybe through the Governors Forum and all the rest of them. I think that is what the only thing they said they are going to do. But remember, there are states that are doing what they're supposed to do. And why we believe that something is wrong with these particular states is that there is no state in the north that is having the same problem. All the states in the north are paying as of when due. They're not owing their doctors. Lagos State is not owing. Delta State is not owing. Cross River State is no longer owing. Akwa Ibom State is not owing. River State is not owing. And some of these states have more money. That is, I'm talking about Abia State, Imo State, Anambra State, Ekiti State, and Ondo State have more money than these other states that are meeting up. So it just shows that the leadership of those states are insensitive to the health of the people. because these are the people who are treating your relatives. It may not be their immediate family, because they have all what it takes to go to a private hospital and to also travel out. But how about the rest of the persons who voted them in?
The questions. Let me take this to my colleague, my colleagues in Lagos. Kaede.
Well, thank you, Mark. We, as usual, needed to have a robust conversation. So just to put it out there, we reached out to the Ministry of Labour and invited them for this conversation so we can hear the different sides. Then we're directed to the Ministry of Health from the Ministry of Labour. We, of course, reached out, invited them, sent a message, called. But as you can see, we don't have representation from the government. And we're really hoping to deal with these issues. It's been a month of a strike. But Dr. Phillips, I'd like to read this statement by the Minister of Labour for you and get your response. It's a part of some things he said recently, saying that doctors should ask themselves questions. Why is it that when your colleagues are in government, you go on the greatest number of strikes? Goes on to say some of these colleagues were presidents, secretary generals of NEMA, and even president and secretary generals of the National Association of Resident Doctors. So he mentioned Dr. Chukwu, Dr. Isaac Adewale, who faced plenty of strikes. And he says since this government came, he has consolidated 4 strikes. Now, this is how I'm going to end the excerpt I'm taking from his statement. He went on to say something is wrong. We need to ask ourselves some questions and be straightforward with the answers. I'm not sure if the NMA and perhaps the resident doctors have had a chance to respond to this particular inquiry, if I may, of the minister.
Well, what I found out is, I think it's the same theory where you have a friend, two of you are very close. Then the next moment he's having a political appointment, and then the next time you're calling him, his phone is not going through. The same thing, these were members of Nigerian Medical Association or the C members, but we immediately get into government, they seem to play their boss bill. They seem to be on the government side. They seem to have forgotten that they were doctors first. It's not because they're doctors. It doesn't even add up. There's no logic about it that because you're a doctor, that is why we want to go on strike. No, it's not that. The fact is that we expected that they will even understand more, and that they will even prevent the ability for strike, because they're able to go to their principals to say, explain to them. They have the opportunity. The ministers have the opportunity of getting to the federal government, getting to the president, and explaining well compared to somebody who is not a doctor. But unfortunately, they're not doing a good job, because I think they're not doing a good job, because it shouldn't happen. In short, the more reason why it should not happen. The doctors are not going on strike unnecessarily. That is how I can answer it. I think that probably the fault is theirs. They have not looked at it critically to say, what do we do to prevent this going on strike? How do we solve these issues that are demanding? For instance, look at it on the 2nd of August, NAD went on strike, and there was no negotiation until they went to industrial court without thinking about the implication of NAD not going on strike, the number of deaths, the number of mortalities, the number of morbidities. So it's just unfortunate. Because
so Dr. Phillips, I'd like to...
that because they're supposed to be round peg in round hole.
And that takes me to my next question, so as we wind down on this in about 2 minutes.
To fulfill these issues before they are demanded.
Right. So this takes me to my next question, Dr. Phillips. If you can hear me, pardon me, we're rounding off in about 2 minutes. But I need to raise this. I know there's been that debate over it is right to have professionals, doctors, as administrators at different levels, or just have a core administrator who can administrate, for lack of a better term, things. So don't you think that with this whole, having a doctor as a minister and all doesn't really guarantee that you have smooth operations of a ministry? Don't you think that then lends credence to that side of the debate that says just have a core administrator, someone who knows administration quite well, doesn't have to be a professional in that field to be at the helm of affairs?
Well, you've just said that, but I will tell you, if you go that way, probably the problem will get worse. because, I mean, the research and publication that show that doctors are better manager for health institutions, for health organizations, and the rest of them. It's just that, I mean, Nigeria is not just getting it right, not just in medicine, but in many other places. There are a lot of confounding variables that you need to put together for us to work properly. So, I mean, making that statement that because doctors have been there and it's not working is wrong, because even when some few non-doctors were there, it got worse. But remember to Professor Nico Ransom-Kuti, when he was the health minister, he did marvelously and perfectly very well. I know why. Because for once, the president of the country, or the head of state at that time, he told him that, please give me a free hand to work. And he said, I'm going to give you a free hand to work. And because he had a free hand to work, he was able to deliver. But now these ones don't have free hand to work. They have the knowledge, they have the capacity, but the issue is that there is politics in it. They are politicians, I mean, and they have to also look at other issues, you know. So
the 21-day ultimatum, when does it expire?
Well, give or take, we're looking about 18th
of September.
Yes.
And
but we are also looking at, we may never really get there. We are really working hard. I think that's where I wanted to cone it down on. You see, each time people keep talking about 21-day ultimatum, I'm not happy, because we should think about using this media to advise government that people are dying by the day, that this strike should have been called off yesterday, and therefore government should act. I mean, we are so excited about 21 days. No, we don't want 21 days. We don't even want to get there. So most questions that comes, oh, what next 21 days? What next when 1,000 person dies? I don't want to get to that point.
I don't think any Nigerian really wants to get to that point. So we sincerely hope that something will happen before the 18th of this month.
Yes.
We have to thank you.
If nothing happens before the 18th of this month, if nothing happens before that 21 days, government should be blamed. That means they don't care for Nigerians. People are dying. I'm telling you, I'm a clinician. I work in the clinic. I know what is going on. It's not like being an administrator where you are not working, you don't even see the deaths. You know, the administrators right now are not seeing the deaths. The government people they are not saying it. But go and ask the nurses who are working in the hospital. Go and ask the people. You will see that now people are going to traditional bed attendants to take deliveries, and it's going to be a huge problem.
Sorry, Dr. Phillips, we're totally out of time. I want to believe that those who are responsible and should be responsible to ensure that we do not get to the 21 days are watching and are listening to the appeal of the NMA on this program. We have to thank you for sharing your thoughts this morning with us, and for being as patriotic as you are with the situation on the ground. Thank you so much for coming on our program this morning. Dr. Ekwe Phillips is the Secretary General of the Nigerian Medical Association. We'll take a break now. We'll come back with another matter for you. Please stay with us.
Welcome back. Well, yes, we've got those two gentlemen, as you've seen, joining us to weigh in on the conversation about brain drain in the country and more. So let's just go ahead. We've got Dr. Austin Sam George. He's a media and communication consultant, former commissioner for information in Rivers State, as well as Honorable Dayo Bush Alibioshu, who is the pioneer chair, actually, of the subcommittee on the AFCC. Good morning, gentlemen. Thank you for joining us today on the program.
Thanks for having me. Good morning.
All right, let me start with you, Dr. Sam George. Incidentally, both of you were professionals before you got into the side of the people, before you got into governments, both at the state and the legislature, because those are arms of government. But now you're back on the other side. So from that perspective, and then you've been professionals, you at least get clear understanding about some of these issues about professionals being underemployed and challenges such as that. But with respect to this conversation about brain drain, it's been a persistent one, even in the health sector, for instance, where we seem to have fallen below the universally recommended doctor-patient ratio. I think they say we have 1 doctor to 5,000 people here, as opposed to what they recommend, 1 doctor to 600, which I think in the UK they have, where some of these doctors are going. How do we even begin to address this?
Well, we address it, Chamberlain, by having, a healthy appreciation for professionalism. I mean, you can't spend as much as parents spend, training medical doctors, and you pay them peanuts. And even when the salaries, and even the salaries themselves in most cases, are either underpaid or not paid at all. Look, there is an economic concept called mobility of labor. What this means is that if your expertise is not appreciated somewhere, you simply move it to somewhere else where it will be appreciated. So that's exactly what is happening. So the very concept of mobility of labor says that if you can't pay me, if you can't appreciate the level of professionalism and expertise that I bring to the table, I will move to somewhere else. And that's what is happening. You see doctors now moving from Nigeria to Saudi Arabia, to the UK, to the US. And these doctors, when they get to these new places, actually function very professionally. I remember during my days at the university in South Africa, in 2 successive sessions, the head of the medical facility of my university in South Africa were actually medical doctors from Nigeria. You know, so if you don't pay, if you underestimate the expertise of professionals, they are going to simply move to somewhere else where they will be appreciated, and it becomes a massive loss, for the country, and again for the host country. If the World Health Organization says we should have a doctor-patient ratio of 1 doctor to 600 patients, and we now have a very serious deficit where we have 1 doctor to 5,000 patients, and then we have this kind of months-long strike action. It shows that we have a very serious emergency situation in the health sector. And I think that we ought to have this kind of corresponding understanding that except you pay and appreciate professionalism, we are going to have this kind of sectoral crisis.
Honorable Bush, does it come across to you as though, well, we understand the import of what's going on, but perhaps the bottlenecks here and there trying to sort some of these out? Because, members in the assembly usually talk about how do we address this. Government says, well, just a couple of things here and there to sort out. What do you think?
I think we need to back up a bit and look at things. Excuse me. First of all, Doctor had already said we do not appreciate professionalism in general, period. Whether engineering, medicine, across board. Now, it's very scary listening to the ratio, but it didn't just start today, where a recommendation of 1 doctor to 600 people is what's required, but that isn't the case. However, it's important to know that people will always travel in the pursuit of greener pasture. Wherever you go, you'll see different, even when you go to the United Kingdom, you'll see doctors from Sri Lanka, Pakistan, India, all over the world, Iran, and so on. However, I choose to look at things from a different point of view, where the focus has been mainly on medical doctors. We're not talking about veterinary medicine. We're not talking about veterinary doctors, especially when you get to understand that the last several issues have been from animal to man. I was reading a report that said that since the birth of Nigeria, we've only produced about 5,000 veterinary doctors. And we have just about, out of the 5,000, some are dead, some have moved abroad. But presently, we only have about 500 in active practice in Nigeria. Now we think, oh, it shouldn't bother us, it's about animals. It should bother us. We consume meat, for example. I would take Lagos State alone. 6,000 cattle heads are slaughtered in Lagos State for consumption. There's an issue with tuberculosis. It can be passed from animal to man. Now, when you take a look at the ratio of 500 across, I'm not even talking about the number of, I'm not talking about the population. I'm talking about the number of states that we have, 36 states and 1 FCT. And you divide that by 500. It gives you an average of 13.5 veterinary doctors. Which means if you look at that, in each state, if you take that average and you apply it in Lagos, I'm just talking about cattle now, 6,000 cattle heads consumed every day. Now, you have the lungs. People consume the lungs of, which is what they call fuku. They consume a lot of that because it's the cheapest or one of the cheapest parts of the cattle. A big chunk will probably be sold to you for 50 or 100 naira. Now, for you to kill the bacteria in the lungs, it means you have to have cooked it over a period of time. But if you do that over 30, 40 minutes, it means it completely breaks down. So you're actually consuming, when it's used for suya, suya is cooked for just about 12 minutes for it to be consumed. There is no way the bacteria would have been killed. Now, why do you think tuberculosis is amongst the top diseases we have in Nigeria right now? How do we address that? We now relate that to the number of doctors that we have. How do you treat that? Are you saying 13 doctors can actually go through and examine very well 6,000 cattle heads? I reiterate, I'm just talking about Lagos State alone. I'm not talking about the other states now. So when you look at it, I think we need to move back and really take a critical look at what really is the issue beyond. Because you find out that by the time you say, oh, they're going to earn ₦1 million and we're a month and we're dealing with other issues, by the time you get to a certain point, even the million wouldn't be enough again.
Let me bring this, Dr. Tam George. I mean, the ivory tower, being a communication person yourself, the issues he's raised, what is the missing link in terms of us as a country mainstreaming such conversation, given the times that we're in now? Because lots of people usually look to the ivory tower for leadership. Societies look to them to chart the course. But over here, I stand corrected, it does appear as though they don't seem to be the leading light. What's the missing link?
Well, in the university is like a factory, where manpower is developed and then, sent across society. You find that wherever there are sectoral needs, for instance, we need more doctors, whether they are veterinary doctors or doctors that treat human beings, or whether we are dealing with engineers, all kinds of professionals are, trained across the manpower development spectrum. The university being the tertiary level. You see, but when these, people go into society, they've got to find jobs. Either they create jobs for themselves or they've got to find jobs either in the private sector or in the public sector. Now, if they find these jobs in the public sector, they've got to be properly remunerated. Once they are not remunerated the way they should be paid, there's going to be a crisis. What we should do, I think, is we need to declare a state of emergency in critical sectors. In South Africa, from my experience, if there are particular shortages, manpower deficits in particular sectors, they classify them as, what they call, manpower deficit sectors, to say, look, we need accountants, and then there is a bespoke, very tailored manpower development programs that says we need to provide this number of doctors across not so number of years. But that means sometimes they go through mentorship, they go through employment schemes, that absorb them even before they get to their final year. But we don't have those we used to have those kind of systems here in Nigeria in the 70s and the early 80s, where, we have job programs, in the universities where, employers go there to say, look, we need particular kinds of manpower and we want to absorb them, give them orientation from this point in the university until they do a transition into the world of work. But we no longer have those kind of things these days. We have one of the highest unemployment rates in the world. According to the National Bureau of Statistics, over 33% of our people are unemployed, and that does not include those who have already given up hope of getting jobs. We are talking about people who are actively seeking employment but can't find jobs. Out of this, we have over 60% of young people not being able to get jobs. So if you have skill and you don't get jobs, or you have skills and you get a job and you are not properly paid, then you have a manpower crisis.
Just to add this bit of information before Khalid comes in, there's this, I think it was yesterday, that the president launched this Jubilee Fellowship program for UCOM members who've just left, so it's supposed to absorb them for a year, supposed to be a year, so who knows if that's the thing. And I think so far, the one for yesterday, 20,000 of them were being that scheme for a year, and then afterwards, well, who knows if it will address this kind of concerns.
Yes, that's a very good initiative. In fact, we should be having more of that, not just at the federal level. Sometimes we tend to give disproportionate attention to what happens at the federal level. We have states as well. A lot of our people are disaggregated in states, 36 states plus Abuja. We need to see a great deal of emphasis on employment creation across the 36 states. So if the federal government is doing this, we need to have that kind of, attention placed on job creation at the state levels as well.
Well, let me take this to Honorable, because Dr. Tam George, you spoke about, an emergency situation, and you said that we should declare state of emergency. It's funny, we've heard that in security, now we're hearing that in other sectors. But Honorable, you've been in government, at least at the legislative level. I know there's always that conversation about whether or not it's government, but it is government, at least that's what we learned in school, and that should be the right thing. The question is, what kind of premium is placed on issues such as this? We don't hear legislators, for example, government appointees protest and say, well, our earned allowances have not been paid. When they need things, these things are provided, at least the much we know. But when it comes to the health sector, we've had 4 strikes in 2 years. Resident doctors, 16,000 of them, have down-tooled for 4 times in just 2 years. And it sort of begs the question, what's it thinking really, honestly?
To be honest with you, it's been over a 2-year period. It's been an ongoing issue as far back as maybe 20 years ago. Probably the issues are getting more than they used to be. One of the things we need to understand is we have to look at policies. If you look at the media, they've had quite a number of, they've had a decent amount of representation at the National Assembly with people like Uche Ubani and a few other members there. The question is, there's a saying that if you want to change a situation, you don't fight it. You create an alternative, or you create the way you look at it and then address it from there. If the medical profession, whether the NEMA, the body as a whole, can look at how to drive policies rather than have it, handed over to them, it would also be a way through which things can be changed. How do I mean? If you're able to sponsor, if you're able to support certain medical doctors, who would have a clear-cut understanding that, listen, the reason you're going there is to change this, is to push this policy, then things get done. You can't, how do you legislate on what you do not have a thorough understanding of? It's always very important to have somebody, an insider, an inside man. It's either you do that, or you decide to look for a sponsor. Look at the tobacco industry. How do they get away with a lot of things they get away with? It's because they have people who represent them, their interests there. I think it's high time that approach be adopted, and then we'll see how things go from there.
Quite interesting, really. But, when bills are drafted, you have inputs, as they say, from stakeholders. You have these experts come on board. They look at, the spirit, the letter of the law, and try to ensure that it reflects the yearnings of that particular sector. Of recent, the controversy around, the press bill and the rest, whether or not, there were wide consultations, as it were, because that's how it is meant to be. So, yes, it is good to have these people maybe in the House of Reps or in the Senate, but there'll be questions around whether you have enough number to even get enough votes to allow those things pass. I don't even want to go into the recent controversies around voting, whether or not things were done the right way. But doesn't that also speak to the representatives' touch with reality? Because whether or not you have as much doctors on the floor of the House, this is the reality. The hospitals in their constituencies, for example, don't have enough medical doctors, don't have enough equipment. So these are things they know and they ought to legislate on.
There would always be legislation at a certain level. But will it... I'll give you an example. I spoke with somebody and I asked... I painted a scenario. A few legislators, we sat together and I said, listen, if you see 2 people fighting, how do you handle the situation? What kind of laws would you prefer? And they said, well, disturbing the peace and this and that. And so I had to take them down to say, listen, lawmaking requires skills, a lot of skills and understanding. have you gotten to understand that there are two operating systems, the cortex and the amygdala? How does each work? And if you haven't trained people to understand the switch between these two, are you sure you're not just going to be jailing people for the sake of jailing them? It's enough. You can come up with laws on the floor of the House to support the remunerations, but is that all what it's about? These guys, they're not just talking about what their earnings are. They're talking about their conditions. They're talking about the professionalism involved in here. They're talking about a whole lot of things. And by the time you get to the public hearings, the one you referred to had a lot of attention because it had been ongoing and a lot of people were interested. As we speak, those who are interested in the welfare of the doctors are the doctors themselves. But it's a different case when the situation or the issue affects beyond spreading outside of the box rather than just inside of the box. So it's not just having those medical doctors there, but having the required amount of support to push through what you actually want.
Speaking about spreading outside the box, at the moment we're talking about curbing this brain drain. But then we've heard executives of corporations, but even at the state level, talk about the challenge of human capital. So it seems as though there are two extremes. Brain drain, the professionals leaving the shores for value where they'll be appreciated. And then you also have available, they talk about the quality of manpower that's available to them needs to be, we need to shore it up. But from what you saw while you had your stint at the government level, give us your perspective of what we're dealing with here in terms of both extremes.
No, I think we are dealing with a manpower crisis. If you have people who have expertise and there is no deliberate public policy to integrate them into the world of work and remunerate them, and they leave or some of them are not employed, you already have a crisis. We are talking about medical doctors now. There are so many thousands of medical doctors who are in fact not employed. They are not employed in the state service, they're not employed in the federal service, and we have thousands more who are leaving, who are employed but have industrial grievances and are leaving the country. So I think what we need to do is to have a very specific and targeted policy response to say that, look, we have critical need in specific sectors. One, how do we generate the manpower, building synergies with universities, polytechnics, and colleges of education, depending on the area of manpower development we are looking at. And then once they leave the systems, once they leave the tertiary institutions, we need to have a system that absorbs them. And then I don't think that the question of salaries should be such a contentious issue. I would have thought that once you recognize that a certain level of manpower development is needed, you come up with specific structures of salary, salaries for the staff. But that flows from an appreciation of the manpower need. My sense, frankly, is that there is a tendency for people in government to believe that, look, if you don't have a job, you better create one for yourself. If you do have a job in the government service and you are not properly paid, you can leave. I mean, we've heard the Minister for Labor say that, oh, well, I mean, if doctors feel that they want to leave the country, they can leave because we have a lot. Now we recognize, because of this crisis, that in fact we have a far lower ratio, a higher ratio of doctor-patient connection. You have 5,000 patients being attended to by just one doctor over time. That's a very serious deficit. That's only for the medical section. What about engineers? We have engineers, who are coming from the universities. I would have thought that if we had direct public manpower policy, you could say, okay, those who are still in the university could take up internships at the ministries of works, even to get practical experience. At the time they leave the university, the state governments, across the country could say, okay, come and work in different sectors, in different sections of the department or the Ministry of Works, Housing, Transport, and the rest of them. So unless we have this kind of deliberate public policy where we work with those who are training manpower and then eventually work out a scheme that absorbs them and then work out a salary structure that's competitive, because these are professionals, as I keep saying. So unless we have that kind of synergy, we are going to have this kind of problem. I think that we should do a manpower study by saying that, look, what are the critical areas of manpower needs in this country? How can we prioritize this? I think Jonathan did something, the Jonathan administration did something similar when it said, look, if you made a first class across the board, especially in the sciences, we will train you wherever you want to go. And they came up with dedicated, funds for those kind of achievers. Over time, not immediately, but over time, over 10, 20, 15 years, you'll see that the country has specific quality of manpower across specific sectors. And that's how you grow. Look at Taiwan, a country of just 23 million people. They have the 6th largest foreign reserves in the world, and they have one of the most technically proficient manpower in the world. They are just 23 million people. Why is that? Because they just prioritize manpower development. They don't have oil, they don't have gas. In fact, to build a house in Taiwan, you have to import gravel and sand from China. That's how tough their topography is. So they just put the emphasis on manpower development, and they have one of the most technically proficient, manpower base on earth. They are just 23 million people. So I think that these things are just a function of public policy and whether we are ready, to develop human capital.
And we've also spoken previously about how, I think this Scandinavian country, Denmark, how they prioritize those who they recruit into the teaching level, because if you're not up there, they just do a lot of things and so. But, well, gentlemen, it's September 1st. So what? What's the significance? We'll talk about that when we return in just a moment. Stay with us. Welcome back. Well, today the Southern governors earlier had said that they were going to sign the anti-open grazing law in their respective states. Well, as you may have seen when we had the opening sequence, some states have alluded to that. They've signed some of those bills. Of course, there will always be reactions, disagreements, agreements. It's a democracy. Nothing wrong with that. Honorable Bush, let me ask you. You've heard about, also seen the way the conversation has gone about security, how we're handling it, who is saying what. And so from what you've seen, are we taking the right measures? Perhaps in addition to that, what should we actually be doing to ensure that we focus on the right things to move the country forward?
When we talk about security, I have always, the security situation from state to state differs, from region to region differs. We also need to appreciate the fact that every administration, since the inception of this democracy, has had a defining crisis as regards security issues. Yes, it's been taken to another level right now, but we need to understand, I wonder and ponder sometimes to say, okay, how do we go about this? And you realize that the local government councils really have a role to play in this as well, a serious role to play. Insecurity does not happen in Abuja and sent to Lagos, does not happen in Abuja and sent to Rivers, doesn't happen in the center and sent to other states. It happens in wards at community levels. Each area has the area commander. Each ward has a divisional police officer. It's important to look at what is being done at those various community levels, at those wards. What has really been happening there? What is the quality of even the representation on the parts of the councillors? How do they see things? What is their understanding of what happens there? If we take that out of the equation, we will continue to look up to the Inspector General in the center to come help handle things that happen in the communities. So how do we break it down? How do we break it down into parts and begin to reassemble, by taking a critical look at things? I think that's something that really needs to be looked at, and it will go a long way. I understand that, yes, you have the state security presence in those areas, but how are they able to function if there isn't the required synergy with those communities? That's the question we should ask ourselves.
Yeah, well, Dr. Sam George, so what did he glean when he speaks about the functions, the operations in states? Because, I mean, these chief executives, they should know better. But here they are with this position that this is what they think is the way out. So in terms of the functions of those security, policing structure in those states, what did you see as perhaps the missing link or the gap that could be corrected?
Well, we are dealing with a paradox, Chamberlain. We are dealing with a situation where the state governors are supposed to be the so-called chief security officers of their states, and yet they do not have any direct command and control mechanism when it comes to dealing with the police force. The police, as we know, is constitutionally centralized. There is the Inspector General of Police, who is appointed by the President, and then there are all kinds of structures, below him. They are all ultimately answerable to the Commander-in-Chief and not to the governors. But then the paradox is that the governors, even if they do not have direct control over the policing structures in the state, also have yearly budgets running into billions of naira as security votes. And so when the governors say, for instance, that they are helpless, and that they don't have control over the security forces, and therefore they are helpless in security crisis situations, the question then arises as to what then do they do with the billions potentially, running into, sometimes if they stay in office for up to 8 years, it really amounts to quite a lot, that they have as security vote. So I think that we need to be very honest concerning our response to the security structure in this country. Do we want to continue with the over-centralization of the policing structure, or do we want to decentralize and have state police? The people, I sense, are ready for state police. After all, I mean, we all come from different communities, and in my own community, for instance, there's an informal policing structure. Not because they wear uniforms, but if somebody goes, too far from legal behavior, they apprehend and then invite the police to deal with those individuals. So there is some kind of community policing happening at one community level or the other. But if we want to formalize the structures and say we want state police so that state governors can more appropriately deal with security situations, are the politicians themselves ready? I think that while the people are ready, the politicians are not ready for state police.
Speaking about the security votes, I had an informal conversation with one of the executives of the states, the chief executive of the states, and he said, look, trust me. Bottom line was, he said, trust me, you guys don't want to know. The country is not ready to know what we actually do with security votes. In other words, I think he's saying that we may be disappointed if we actually find out the kinds of people or institutions that benefit from such funds. That's the impression I gleaned from it. But about the state police, because I mean, almost at all levels, they always argue that, well, remember what we had before? We had this regional police, state police. We saw what happened. Some politicians did certain things, and that, well, why should we have state police? You mean federal government cannot do certain things? How do we go about that conversation? Because it's something you say needs to be done, because informally it does exist in different states.
I think that the citizens are ready for state police, but the politicians themselves, I'm telling you, because I've been in government, they are not ready for state police. If they will use it in a way, I mean, we are dealing with one problem now, but we'll be dealing with 36 major crises, once, we allow state police. I think that what we should do is to introduce a great deal of accountability and transparency first in the policing structure and in the way public finances are used. I mean, I would like to know, for instance, what governors do with billions of naira budgeted every year as security votes. We need to have that conversation to see whether there is accountability and transparency. But I think that for me personally, I would rather want to see the security votes. Sometimes states have as much as 20 billion naira, 30 billion naira annually for security votes. I think that money should be deployed towards job creation. Sometimes we forget the connection between lawlessness, criminality, and joblessness. I think that we should have an understanding that, look, the more and more good paying jobs that we create, the more empowerment schemes that we create, the lesser and lesser we will deal with criminality. So this kind of connection is the missing link. There is a tendency to always look at only the hardware issues. How do we buy baton? How do we buy guns? How do we buy bayonets? To fight criminality. But I think that if given a chance, more and more people would rather lead a legal and profitable, useful life rather than resort to criminality. And the way to go, therefore, is to dedicate these so-called, security votes to create targeted jobs. I want to see those jobs in verifiable numbers across the states every year, so that we will minimize the tendency for criminality.
Okay, I'll go to Honorable Son, but as Chamberlain said earlier, you were on the side of the people, then you went to government, back on the side of the people, and perhaps it's only fair to ask you about security votes, because you're as curious as a lot of other Nigerians. While in government, did you find out anything about it?
Well, I can't account for how security votes. I was never governor. I was commissioner for information. I didn't have information about how these security votes were spent. And it's not just in Rivers State. I mean, across the country, we need to know, if governors are budgeting and actually collecting billions of naira annually, every year, and some of these governors remain in office for 8 years without a single shred of paper to show, in terms of transparency and accountability, what they actually used, these resources for. I think that when you use public funds, appropriate, public funds to this extent, to the extent of billions every year in the name of fighting security, you can't legitimately claim to be helpless and simply say, oh, well, I don't control the police. If you don't control the police, what do you do with the security votes running into billions? These are public funds.
Interesting.
I think that the way to go is to introduce more accountability and transparency in the way some of these resources are used.
So, with the benefit of hindsight, I just need to resolve this.
Yes.
If you were still in government, would you say, well, we need to know?
Oh yes, I definitely would suggest that. Look,
so that's something you wish you had done then.
Well, when you are a member of the Executive Council, you can only make a suggestion, but the implementation, the acceptance of, and framing it into public policy is the responsibility of the Chief Executive of the state.
Okay, Honorable, I'm glad we're breaking this down. I mean, you essentially started from saying we should start at the grassroots, basically. I mean, break this down. Don't let it sound as though all the attacks happen on the national scale. They happen at the wards, at local governments. And he pushed it up to the state governors, saying, how about the security votes? And, regarding this conversation, you might want to respond to that as well. But are state governors really ready to be the chief security officer? I mean, we've heard state governors speak united on issues, things about bailout funds and the rest. They have one voice. And if they really wanted to make a change, as well, I imagine it's that easy. Call your legislators across the state and say, this is what we need you to push when it's time to push it. And I imagine it will be quite easy. So, adding to what Doctor has spoken about earlier, do you think we're really ready to have that conversation? Are we really helpless?
There's a saying that in the court of law, both parties know the truth. It's the judge that's on trial. Why would any executive want to take control? You don't have to take control. You can have a good working relationship. It's all about working together, like the components of a vehicle. The steering isn't related to the gear. The gear isn't related to the clutch, but they have been put together to achieve a common goal of moving from one location to another. I have listened to this and I have heard it over and over and over again. But we're in a society where sometimes to hang the snail, it can be accused of overspeeding. We need to move away and focus on what are the issues at hand. With total respect to Doctor, sometimes when you want the truth, the question is, can you handle the truth? When you ask, in this, I wouldn't mention the countries, but we're aware of countries that actually pay people to stay away and not commit crimes. Countries that focus on tourism. How do they explain such spendings on the budget? What do they call it? Under what header? So it will be very, very, very almost impossible for those governors to explain. I haven't been a governor, so it's not like I'm siding them or I'm being on the part of the. I'm neither on the part of the people nor am I on the part of the government. I am being a Nigerian first before sides are taken. How do you explain those things? And it's usually hard to see governors not get along with their commissioners of police. It's usually hard. And when there isn't a good working relationship, most of them make a request to have the commissioners redeployed. However, when you take a step backwards and you look, you discover that there are a lot of issues. Even when you look at, I'm not blaming the police, but sometimes it's important to take a closer look at how certain things are done. Hardly do you see a commissioner of police work in a particular area for more than 2 years. Boom, he's moved to another place because somebody else, they need to, it's as if there's a policy that requires them to be moved around ever so often. So by the time you see one now, he will tell you, oh, I'm DPO in this area. In another year, he will tell you he's been moved elsewhere. And then it's a cycle that starts all over again. You also see that there are a lot of states that have, what I think Lagos State started it under Governor Fashola, when Fashola was governor here, a security trust fund. Most states have come up with this to combat, to fight these things. And I'm aware that a lot of states, the security trust funds have a fund has the cooperation of private practices, banks, and the corporates, a side of society. But there's a cultural issue there. There's a basic cultural issue that if not sorted, if not taken care of, it's not about the Buhari administration or the Goodluck administration, or every administration has had a defining security crisis in this country.
Well, if you could give your response in as short as possible with this one, in consideration of Dr. Tam George's perspective about state police, there are many who are of the impression that the National Assembly actually are, quote-unquote, a clog, because they think that, especially underscored by what they saw the last time, that the vote on whether or not state police should pass stops or is impeded by the National Assembly. Do you share the same view?
Well, to be honest with you, they were elected as people with the ability to make rational decisions, as adults, with stable mental capacity. Now, to get them to do what you want means you have to convince them. I've said on the program here before that there's this intentional divide created, us against them. And when that happens, you see that there are sides. You now have to play some level of politicking to say, you know what, guys, and like I said, there's the governors forum anyways, and these governors have these, all the governors that make up the governors forum have this, to a certain extent, some level of influence over their representatives. So if it's something that's really, truly required, why can't they all come to a round table?
Some argue that they thought that it came across to them as though party loyalty seemed to overshadow that influence that governors will have.
And that's why I said earlier on that it's cultural. your ability to see things. What is culture? Culture is just the collective programming of the mind, how you see things, the lenses through which you look at life. If you're able to change the way you look at things, the things you look at will begin to change. So when that is the case, the most important thing is most of the representatives have town hall meetings. I know the Lagos State Assembly just had one on drugs, or the use and influence of drugs. Members of the House of Representatives also do this. So it's important to engage them at that community level rather than stay away. Even when these town hall meetings are called, what you find out is 80% of those present are also politicians.
Oh dear. Well, Mark has got some questions for you. Mark, go ahead.
Indeed, mine is for Dr. Tam George when he's talking about the state, it was in the state on one side and the people on the other. Some people will say that aren't they supposed to be working towards a common goal? But I think that the big question right now is this. I mean, with regards to the crisis which has necessitated this bill, this deadline, it would seem that the southern governors gave, the farmer herders crisis. Now, there are questions as to whether this was the right way to go, because what we have seen is that a number of states, for instance, the Southwest decided to react by setting up Amotekun. We saw an attempt in the Southeast to come up with something. Even the South, there was some movement in that direction. But eventually what we saw across board for southern governors was this response to ban open grazing and to say, some states say they're going to enforce it. Now, I don't know how this has been perceived in other parts of the country, but it does look like there's going to be, or that there is some I don't want to use the word misunderstanding, but it looks like it has not been very well received in some quarters. There is some resistance to this. How do you think that this will work, the enforcement of the bill, of the law rather, for those states that have passed it, with regards to those at whom it is targeted? Do you think that this is going to further foster unity across the country, or do you think that this has the potential to degenerate?
Well, I think that, you know, the state governors have direct administrative oversight over their states, and that comes with legislating social behavior in their respective states, so long as it doesn't clash with the provisions of the Constitution. Open grazing is something that obviously has created a very major public debate. And I think to some extent it's unfortunate that we've spent nearly the better part of 7 years in this country simply debating the movement of cows. I don't think there's any country in the world that wastes so much time talking about cows the way we have done. But the question of open grazing is now obviously a legislative matter for so many states. I recall that when I was in government, we didn't have open grazing legislation in Rivers State, but we apparently have now. The governor, I think a few weeks ago, have signed legislation forbidding open grazing. I think that the state governors should rise to the challenge of regulating animal husbandry in their respective states according to the peculiarities of their states. If you pass a legislation in Rivers State, I don't think that your intention will be to please someone living in Zamfara or someone living in Plateau. You simply want to look at the specificities of your own realities in your state and then respond legislatively. I think that the question of the federal government wanting open grazing in 25 states, I'm supporting it with public funds, has generated a very unfortunate public debate. Let the state governors decide what is good for their people. It's consistent with federalism, and if they think that open grazing is something that is not allowed, especially in agrarian states where open grazing would mean that cattle will be moving from farm to farm, consuming farmers' produce. This is a very serious flashpoint in many states, and I think that if it calls for legislative action on a state-by-state basis, the state governors have a responsibility to rise to the challenge. That's one part. The second part is that we now see a very unfortunate intersection between open grazing and criminality. We've seen so many accounts by people who have been abducted, whether in Edo State and Plateau, in other places in the country, where they say that, look, we suspect that even those who abducted us, those who are involved in open grazing, do not even seem to be Nigerians. They seem to be speaking language that is not indigenous to Nigeria. The system appears to have been infiltrated by all these kind of people who can, I think, only be controlled by strict legislation concerning open grazing. So in states where open grazing are allowed, I think they should allow it. But in states where they think that open grazing is a flashpoint, for crisis, I think they need to respond legislatively, and I suspect that that's what the southern governors are doing.
All right, gentlemen, we need to wind down. But just very briefly, Honorable Bush, there was the House had this security summit, and then they made 7 recommendations, part of which was that's to the president, one of which was that they should declassify security votes after 4 years. Would that be a good idea, in order to address some of the security challenges anyway?
I'll be very honest with you and tell you that I haven't gotten to do a closer analysis or take a closer look at that. But now you have my attention on that. So it's something I'd want to look at closely before I'm able to comment on that. However, if you do not mind, in just a quick moment, to address the question that Mark had asked the doctor, I think a major issue is that the open grazing bill has been seen as some kind of vendetta, some kind of thing to address the issue. However, if it was taken from a completely different angle, from a different point of view, like I said, I'll take the Southwest, for example. How many states do we have in the Southwest? And where 6,000 cattle heads are consumed here in Lagos State alone. Isn't this the kind of business that shouldn't it be looked at as a serious kind of business, which will ordinarily eliminate let open grazing just die a natural death?
All right, and I think there's some thinking in Lagos. We've seen, semblance of what you mentioned. But that's where we have to let this conversation go with both of you. Honorable Dio Bush Alebiosu, former member of the House of Reps, pioneer chair of the House's subcommittee on the EFCC. We've also had Dr. Austin Sam George, communication and media consultant, as well as a former commissioner for information in Rivers State. Gentlemen, thank you both for coming on today.
Thanks for having me.
Thank you for having us.
Well, let's just get right to some of the emails, at least we can today. The very first one coming through, there you go, that is coming through from Demola Alalade on the State of the Polity. He says, the uproar about the security challenges confronting the country is overwhelming, and by now we should be seeing traction on how to respond to the challenges faced in all parts of the country. My concern is that if the root causes are not dealt with by providing an enabling environment and employment for the people to thrive, then the security issues will never be resolved.
Well, the next mail is from Isioma, but I think it's important to just clear this about the number of registered veterinary doctors in Nigeria. 9,000 of them, about 3,500 are in active practice. But take a look at this one from from Isioma on medical doctor strike, saying it is sad the medical strike is still ongoing. Ordinarily, I will blame the doctors for being on strike this long because the medical profession is trained primarily to do no harm and save lives, but their experience with a government that has constantly underpaid them, no up-to-date medical equipment, shabby working conditions makes one understand why they are determined to get it right this time.
Nakena has this one, says there's no need for this unnecessary and egomaniacal behavior, I hope I'm pronouncing that right, by both parties involved in this impasse. The average poverty-wrenched homes are dying in droves. Every hand must be on deck to end this strike. Nigerians deserve better health care.
Festus says about the NERD NMA industrial dispute, sadly, It doesn't look like this strike by doctors will end peacefully. It's time government and doctors understand that their actions are having serious consequences for Nigerian parents. My advice to Nigerian doctors planning to come to the UK is to think twice, because UK doctors are leaving the NHS for lack of adequate investment in the sector. The grass is not always green abroad.
Oh, yes, especially, take a look at Hadi Ibrahim's mail, and this is, of course, on the same issue. And it's quite short, as you can see. NMA, you have to pity the Nigerian masses because people are dying.
And Victor on NMA's 21-day ultimatum says, health, they say, is wealth. A healthy people make a wealthy people. If we're healthy physically as a nation, the wealth of Nigeria will be enormous. Let's please separate politics from health. Government should be sincere and fix our health sector. NMA coming in now spells more trouble for the common man. Well, it's not supposed to. We certainly hope it wouldn't. I think we still have a few more.
Yeah, Kenneth also weighs in on that NMA ultimatum, saying, on the recent doctor strike, until politicians and the ruling class stop patronizing foreign hospitals and doctors, they will never have interest in fixing the Nigerian health sector. My prayer remains, God save Nigeria.
And finally from Henry, is there any way a poor and weak health system can foster thriving industrial relationships and robust healthcare delivery? NMA drew the attention of the FG in 2015 to full implementation of the National Health Act and the Yayale Ahmed Presidential Committee report as low-hanging fruits for fixing the broken and non-performing health system. We've dwelt on this mountain for decades, yet we expect change. How? He says.
Big questions. Well, your mails and feedback, we don't take them for granted. We always will do as much as possible to take them, so please keep them coming. Thank you for your contributions and watching today. I'm Maupe Ogun Yusuf.
I'm Kayode Okikele.
I'm Chamberlain, so goodbye.